Also in the orders tab, we have blood bank orders. So this is relevant for our patients who need transfusions. As you can see, there are a number of different options here to help simplify. So we can select type in screen. So we want our patient to get a type in screen. This patient coincidentally has an order for that already, but we'll say, yes, we need to type in screen them again. Unfortunately, it doesn't come up with default settings, but you can see they have some basic patient information available here, the blood bank orders, which we'll discuss, and then lab results that might be relevant as well. So under the blood bank orders, again, we can select personal quick orders. I have a quick order set here for an AM type in screen, so that way it'll be drawn with their AM labs. Again, in this case, it's trying to automatically enter this order. So I want to say, no, I don't want to cancel. Um, and we'll just have these settings that come up from my quick order. But generally, you would choose type in screen under diagnostic tests rather than under blood components, which is often the first thing that comes up. Um, uh, we could select this as lab collect, and then AM. This would be a better setting, to be honest, than the default setting that was in. We'll select this as routine, hemoglobin less than 7. No need to comment here. And we would say accept to enter this order. If we wanted instead to order a transfusion, then we would select this and select red blood cells, and you'll see the type in screen disappears here because now we're entering a transfusion order, which is a blood component, rather than ordering a diagnostic test. So we'll say we want to give 1 unit. We can modify that if needed in these different ways. And then again, we could increase, let's say our patient is really bleeding a lot, they have esophageal varices, in which case maybe we should give a couple of units and their hemoglobin is less than 7. And again, we would say accept, sorry, they want the date and time for this. So say now, and say accept. And now it should ignore these settings from the diagnostic testing and just enter what we did for the type in screen. We're here back at the main blood bank order menu, and as you can see, other things like platelets, cryo, FFP, etc. are available here. We can do our direct antiglobulin testing, transfusion reaction workup. So we have a pretty nice order menu here, depending on what's going on with your patient. We'll say done and cancel this order because we don't need to enter every order for this test patient.